Hi, today I want to talk about the 6th International Conference on Hyperacusis and Misophonia, which is planned for 1st and 2nd of July 2022 at Birkbeck College, University of London. And so it's a Friday and a Saturday. And from next week, my plan is to have brief interviews with the confirmed speakers of the conference in order to get some insight about the background to the research that they want to present, and also to understand what is the key important things that the audience needs to look for from their presentations. And I'm going to share these on social media with the hashtag ICHM6, which stands for International Conference on Hyperacusis and Misophonia 6, the number 6. And so the aim is to generate discussions about those topics that will be presented in the conference, and you can post your questions, so which I will share with the speakers in order to address in their during their presentations if deemed appropriate. And so the conference for this year has 5 main topics. The first topic is psychological interventions for misophonia and hyperacusis. We will talk about audiologist-delivered cognitive behavior therapy, dialectic behavior therapy, and also cognitive behavior therapy models delivered by clinical psychologists for this population. And also there is a discussion about what we can learn from different approaches and conceptualization of the distress linked with hyperacusis and misophonia. And the second key session is about the non-psychological interventions. We're talking about the various forms of auditory training, as well as interventions delivered by occupational therapists for children on autistic spectrum disorder who may also have hyperacusis and misophonia, and also the link between hyperacusis and misophonia and auditory processing disorders, which pediatric audiologists will talk about the interventions that they offer. And also we talk about certain physiotherapy interventions for people with hyperacusis. The third session of the conference is about the mechanism of hyperacusis and misophonia. We talk about the imaging studies, electrophysiological tests of the auditory system, and other biological markers that could be found for hyperacusis and misophonia in population of patients with tinnitus or without tinnitus. The fourth key session is about assessment, how hyperacusis and misophonia can be assessed reliably. And there is a wide range of talks on that. A lot of PhD students will present their research studies in that session. And the final session of the conference is about hyperacusis and misophonia among a population of patients with tinnitus, and what we can learn from the interventions that has been designed for tinnitus for helping patients with hyperacusis and misophonia, and also the impact of some of the otological interventions on these conditions. So from next week, I'm going to post interviews with the speakers about their presentations, and please feel free to comment and then share them among your friends and colleagues and people who you find it might be relevant to them. So thank you very much for listening.